Aloha gang, Dr. Russ Rosen here, and I'm very, very excited to have our special guest with us today, Dr. Brock McCurdy. Dr. Brock, welcome aboard.
Hello, thanks
So,
for having me.
Dr. Brock McCurdy is an Aussie who's been living in Barcelona, Spain. I had the incredible, fun time of being able to go play with Brock. God, maybe 8 years ago, 10 years ago, something
Yeah,
like
that
that.
was good. That was fun.
Yeah, on that tour that I did, I was speaking out there, and you and I got to hang for several days. We went to
Yeah,
the Gaudi museums or the Gaudi church or
yeah, yeah. It's
whatever
like
it
a
was.
church museum slash museum. It's beautiful. Yeah, yeah.
Yeah,
We
yeah,
went to have tapas. Yeah,
unreal. Yeah, and had a whole
yeah.
bunch of tapas, which were great. All right, so listen, gang. The reason why I've asked Brock to be with us is this: number one, he and I have worked together for a long time. Do you have any idea how long we've played together?
Started in 2008. So
Okay, so
yeah,
a while. Um, and Brock is one of these guys. What makes him so special, other than his boyish charm and good looks, is that he actually does what he says he's going to do and then some. He always does what he says and then takes it to the next level, whether he's working with his staff, whether he's doing our program, whether he comes up with his own things. He's just one of those guys who just simply does what he says. And amazingly enough, his practice is thriving, and everybody would love to have a practice like his. So I've asked him aboard today because he has put together an incredible program. Now we're going to be going into great detail about this program in the club today on Thursday. And you'll also gain access to this program, a free month. But I wanted to tease you. I wanted to let you know what we're going to be covering. So, Dr. McCurdy, tell us about the program that you put together and why it's so important.
Okay. Well, thank you for your kind words, Russ. I'd just like to shout out that I really do attribute most of my success as a chiropractor to the work I've done with you. We've done so much close coaching over the years, so I'm super appreciative. And what I created is I'm super proud of it. And it's really an evolution of some of the work that I was doing with you, which is your re-eval forms. So basically, we do progress exams. Most of us listening to this call, I'm sure. And basically, I was measuring patients' subjective improvement for around 15 years using Russ's forms. And I wasn't just measuring stuff like presenting complaint, like back pain, neck pain, stuff like that, but other things like energy level, ability to handle stress, quality of sleep. So after 15 years, I had almost 3,000 forms, like just sitting there in these boxes full of data. And I'm thinking, I want to get my stats. Like, I know I'm improving sleep, but by how much? And ability to handle stress, well, people say that improves, but exactly by the second progress exam, for example, by what percentage? So I thought I'll get a data analyst to come in, go through all these forms and collate like a scorecard. And I thought, okay, that's an okay short-term solution, but it's not repeatable, expensive, there's human error. So I thought there must already be a digital product out there that not only captured the data, but tracked it at the progress exams and leveraged it for patient education. So I called around all the big companies that might do this and no one was doing it. So basically I built it myself. And I didn't actually build it. I have a team of developers that built it for me. And when I started using this program, something started happening, which really wasn't why I built it. I noticed a lot more patients were continuing care after the initial complaint, which is usually some sort of pain subsided, because they could objectively see changes in how they were feeling. Basically, what we're doing was capturing the experience the patient had under care and showing it to them in a contemporary, understandable format. So the main thing I was noticing, I guess, is PVA. People were continuing after their second progress exam when usually they were feeling a bit better because they could see they added a lot more value to chiropractic care because they could see, wow, my sleep's improving, my energy's improving objectively. Also speeded things up a lot, made communication really easy in the progress exams, and also helped with internal referrals. So chiropractors saw what I was doing and they said, you got to get this out there. So I turned it into a product that other chiropractors can use and actually other health professionals. It's already gone outside of chiropractic, but chiropractic's my main focus. Yeah.
Yeah, look, gang, if you want to help people get healthy and stay healthy for a lifetime versus just getting them out of pain, we have to measure more than just how they feel. The original form that Brock was using was this one right here,
Yep, I
which
remember that one.
in the club, I'll be giving you this form, but I'm really recommending that instead of using this form, and we have ones for, adults, infants, and children, but, this right here is your symptoms that you came in with.
Mm.
All of this is things they're noticing going on in their physiology and their experience of life. And this is all what's happening in their life, right? In their quality of life, their eating, their exercise, everything. Now, that's when they're out of pain, which usually happens pretty quickly. Why would they stick around? I always talk about, most of us are really good at talking to people from negative 10 to zero, right? They're running away from the barking dog. But how do you talk to people when they've been out of pain for 30, 60, 100, 150, 200 visits? What do you
Mm.
talk with them about? How do you talk with them? How do you monitor that? And that's what Brock has put together. And again, if you want to help people get healthy and stay healthy for a lifetime versus just getting out of pain, we must use these outcome assessment tools. And the truth is, it's the Achilles heels of all natural healthcare providers.
Yeah.
So, I coach chiropractors, naturopaths, acupuncturists, osteopaths. It doesn't matter. Our outcome assessment process, our reevaluations, et cetera, are the Achilles heel because A, we don't do them or we do them, but they suck.
Yeah.
And what Brock has put together is absolutely genius because it's so simple.
Yeah.
It's absolutely so simple. So in the club, we're going to be going into more detail about this, and Brock's going to be walking us through, and you can see how simple it is. How long does it take if somebody wants to jump in and do it? How long does it take for them to figure out how to start doing it and be ready to go?
You mean for a chiropractor to implement this into their practice?
Yes.
Yeah, it's super quick and easy. So, I mean, signing up just takes a few minutes, and I do one or two implementation calls with the practice, which makes it happen really fast. It go for 30 minutes each, and then you're ready to rock. Um, yeah, it doesn't take that long. It depends on how deep you want to go. You can upload your own videos, you can customize questions. So some people want to like go a bit deeper, but within 1 week to a month, depending on how fast you want to go, it can be implemented into your practice. Yeah.
Yeah, fully implemented. And then you can watch your stats. I mean, the whole thing is absolutely brilliant. So if you'd like to actually see it in action, and if you
Yeah,
would
so
like,
just can I just add on that just on the stats?
please,
So yeah, what this does, which hasn't been done before, because I try to buy it and it just doesn't exist. You've got Russ's form, which is brilliant. But the problem is, or what we're not getting out of it is the data. So this leverages the data. So what the patient gets, it gets that data and shows them in a fitness tracker-like experience. So it just makes the education of other changes apart from pain a lot more obvious to the patient. And we collect the data from the whole practice. So after using this for a year, for example, you can know the average improvement in sleep through the care you give. And you can use that to give more transparency with expected results, use it for marketing, use it in your newsletter. So it's leveraging data for the patient education and for your overall practice statistics. Yeah. And it
yeah,
just takes a few minutes for the patient to fill out. It's super quick and easy. Yeah.
yep. And again, as we all talk about, why do we have patients fill this out during the exam? You could
Mm.
fill it out, your CA could fill it out, but when they fill it out, they take ownership. When they
Yep.
fill this out online, they take ownership and they can see, oh my goodness, look at all the changes that are happening for me more than I had expected, right? Which
Mhm.
is, 0 to +10,
Yep.
which is what we want to see. If you would like to see it in action, we'll be going into the club and Brock will be with us. We'll be diving into the reevaluation process, including this. And you can also get a free month's access to Brock's program. Brock, if somebody was thinking of doing one-on-one coaching with me or joining one of our programs and they were wanting to lean in, and you've worked with me for many, many years, and I know quite a few folks that you've referred to me, what would you tell them?
Well, I'll give my long story short. Okay. So when I started with Russ. It was just before 2008. I was new in practice, quite a good adjuster for the little years experience that I had because I'd done a lot of adjustment seminars and was super motivated and but not really good at business communication and systems. So basically, I called around and did like the free consult, a lot of coaches do, and I just wanted the best. And so I asked my friends, and just clearly, Russ was for the way I wanted to practice his message, his care, not scare model. And he's a really cool guy, and he was just really successful. Like a lot of top chiropractors have gone through him. I said, "This is the guy." And at the time, I don't know if I told you this, Russ. I think I was spending more money on your coaching because I was just broke. But I thought I'm just going to put everything, all my eggs in this guy's basket. Is going to save me because my practice was really struggling. And within 6 months, man, I was rocking it. You just totally transform, like almost about to go under person, and in 6 months you turn me around, you know. So it makes me emotional even just talking. I'm super grateful because if that didn't happen, I don't know where I would have been. And I worked, as you said, like I took your stuff and I said, this guy knows what he's talking about, and I implemented it, you know. And yeah, and I'm just so grateful. So I really like just highly recommend his material because it's worked for me. I've seen it work for other people. It comes from the heart. It's not about manipulating people. It's just about being honest, and it's just really great work. And it's yeah, I've got definitely. I don't like to say the most successful because I don't know. There's other very successful people, but definitely one of the most successful practices around here. And my systems are based off your work. You know,
Yeah, beautiful.
so I totally recommend it. Yeah.
Awesome. Thank you, brother. So listen, gang, if you'd like to know more about this, go ahead in the comment section, put club, and I will give you a free month access into our club. You can join in and watch the masterclass that I'm going to give, and then Brock will take us through, and you'll get to see how simple his program is. So as always, I got to find the little gizmo right here. Much love and aloha. Bye, gang.